I'm Rob Dansman, and this is The Better Semester, where I provide insight and actionable advice to parents of college students. I'm a nationally certified counselor and licensed clinical mental health counselor, specializing in work with college students and their parents to improve mental health, organization, and motivation. All right. Steve, thanks for being here this morning. I really appreciate it.
My pleasure, Rob. Good to see you.
So let's jump right in. What's your formal role? Where do you work, and what does a typical day look like for you within that role, and how you spend your time professionally?
Yeah, so I live outside Philadelphia, and I'm a child, adolescent, adult psychiatrist. So I have an MD degree, so I went to medical school, but my specialty is psychiatry. And what that means is that I have a medical way of thinking, which tends to be, let me get information, make an assessment of what I think is going on, and then consider different treatment possibilities. So that's sort of like a medical way of viewing how you assess people and do intervention. So that's how I'm a psychiatrist. I'm also a medical educator at the University of Pennsylvania. So I teach medical students and trainees. And my typical day includes pretty much always going to get some exercise, and which is pretty crucial for me, and seeing patients, talking to colleagues, communicating with medical students or trainees, typically, here and there during the day. And my day tends to be maybe 6 to 8 hours, and ends by late afternoon. I tend to be an early person, so I'll start early, but never going into the evening and never on the weekends.
What do you think is the ratio of working kind of directly with clients versus medical students?
Yeah, probably 80% clients and patients and 20% trainees. And then I have the luxury of being a child, adolescent, adult psychiatrist. I have the luxury of seeing people of different ages. And if they're young, working with their families. And that gives me I think, unique perspective to think about people of all ages. Because when I see young people or older people, what they do is, in different ways, invite me into their lives. And families invite me into their world. And it gives me an ability to understand what their experience is. And so there are some people who I see have the luxury of seeing for many years. They're younger, then they get older. And I understand where they've come from, psychologically. And I understand maybe how their families evolved over time. And then when they're in a certain life space, let's say young adulthood, I have an easier time understanding where they've come from and what's happened and what's led them to have, let's say, difficulties at this time. Also, corollarily, I can see young people and predict, if such and such happens, then I think we'll see this outcome. And given concerns with young adults increasingly these days, I frequently will talk with parents about, these things I think you can do to help assure certain types of, outcomes later on. So I think having the perspective of basically a lifespan psychiatrist is a nice way to be with patients and clients.
Right. So is most of that 80% of that time with clients, is that mostly talking about medication? Is it talking about complicated medical conditions or the neurological side of things? Like what exactly are you doing in that session with that client?
Right. When I think of what actually happens when I'm with a client, I think of what happens is we're having a relationship, and I'm helping them provide a way to feel open and express themselves in a way that feels like they're being listened to. And I ask questions that hopefully follow from what they're saying, allows them to reflect on themselves and take themselves seriously. So I think what happens is primarily we're having a relationship. And for many people, that's really unusual to have a space where they can be heard, where they can increasingly feel that they can express themselves. And then we get to the matters at hand, which are sometimes what they present, like what they say is the problem, and then sometimes what I see.
Mm-hmm.
Sometimes medication is discussed. I would say actually much of the time, because many people come to me ostensibly for medication. When they come to see me, though, as opposed to some other people, I'm really wanting to understand them as a person and understand them more globally, understanding where they come from, what their strengths are, what comes easily to them, what's more difficult to them. In thinking about what makes sense for them as far as intervention or what we do, medication may well be part of that. And so medication is often a discussion. And then when one is using medication, there has to be a lot of discussion about what we would like to happen due to the medication, and then what are the options of what may happen should they take medication, and then what do we do? I happen to be someone who does not like to be on the phone or on the computer so much outside of sessions, so I tend to be pretty thorough in outlining and then writing down for people what we can expect and what to do if certain things happen that are not ideal.
Right. How'd you get to this point? I mean, it's the question around like kind of career trajectory. Like, how did you get to this point? Because there are many ways to work or get into mental health, behavioral health, whether it's a social worker, counselor, psychologist, psychiatrist. Yeah, what was your path?
Well, I think we come into adulthood taking seriously what our experience has been previous in life. And so I was someone who liked certainty, like knowing what to expect in the future. I also was a child who was very, I think, hungry for connection. And I had a lot of friends, but I was still hungry. And I remember thinking when I was like 15, I wish I had a therapist, someone to talk to openly, really openly, and someone who would listen. And I don't remember actually like sitting there going, I wish I had a therapist, because I probably would have gotten a therapist, but I had some awareness of that. I thought about, well, what am I good at as a teenager? What am I good at? And then what might I be certain about as far as career? So I was good at math, and I was good at doing well in school, and I liked school. So I was sort of passively led to engineering. I'm going to apply to engineering schools for college. And luckily, I had the wisdom before college to say, no, I'm not going to do engineering. I didn't even know what engineering was. That's the sort of mindset of a teenager. You won't necessarily have the thorough thinking that we adults think people of all ages have. So I went to college, and then I thought, all these other people are pre-med, I'll be pre-med, without actually knowing what pre-med was. And then I didn't really know how to study. And I just happened to live with some people my second year of college who knew how to study and do well. And then the school offered this internship with a doctor. And so I chose to work with a thoracic surgeon, and I loved it. And I thought, okay, I'm going to be a doctor because this is interesting. I can do well in school, and I'm going to be sure of a career, a job. I'm going to be sure that I can get a job. And for me, seeing my sister, the narrative I had about my sister was that she had to look for jobs, and that was stressful and uncertain. I didn't like that. I wanted certainty. So I said, oh, I'll go to medical school. And well, I'd like to go to medical school. And then learned what to do to make yourself a good applicant to medical school. And then went to medical school and realized, boy, I'm good at school, but I'm not really good at most of medicine. Didn't make sense to me. The way my brain worked didn't make sense of physiology. I couldn't understand it. It was tough. And I felt very different from other medical students. But what really was very easy for me was anything that had to do with neuroscience and psychiatry, basically. And I thought, thank goodness, it was easy for me. It was so interesting. parentheses, everything else was hard and not easy to understand, but I went with what I was good at and luckily what I was interested in. And so I said, oh, I want to do psychiatry. And then also with the mind of, I like certainty, I went to a training program at the University of Pennsylvania, which was largely neuropsychiatry based. It was very medical psychiatry based. And then I luckily had an open mind and fantastic mentors who, or with whom I changed my mind completely, or not completely. I changed my mind and was really interested in psychotherapy, the connection with people, therapeutic work, and then eventually child psychiatry. And I had always been intimidated by communicating with kids, basically, but found that that was actually something I was good at and liked. So from my experience, finding something that I was good at, being good at school, um, and that I liked was a great combination. And that's an ideal situation for young people, I think. That's a long answer.
I love it. I've got a few follow-up thoughts and questions. This is not going to go in the order that I wanted to, of course. Where was undergrad for you?
University of Virginia. And I stayed there for medical school. And I will say, where the tuition for college was $700 a year, and the tuition for medical school was $4,000 a year. And I mentioned that because it's so striking that, college, grad school are prohibitive for most people. And if not prohibitive, then they wind up engendering a ton of stress due to the economic ramifications of writing those checks.
Are you from Virginia, or are you from...
Yes.
Oh, okay.
And that's why I got great tuition deals. Yep. And I was mindful as a young person about financial stress because I had other options that were more expensive, and this was at a time where I don't remember students, or I don't remember friends going, I need to get into the best college I get into, or I don't remember people being stressed about college because it wasn't as hard to get into. But even so, the idea was you go to college and you get out of it what you put into it, and you have a positive experience anywhere you go, which is different from people's experience now.
One of the things that strikes me about how you kind of unpackaged kind of your trajectory, I spend a lot of time talking with students about kind of majors and internships and career and all that exploration. And what I've found over the years is that the most satisfying outcomes normally come from an intersection of ability, interest, and compensation. And what you described is figuring out what not to do along the way, which was almost more important than what to do. It was almost like the heck no's were actually more important to avoid. And I mean, would you say that that's accurate?
That's a very great observation, because I think that's true, in a way of protecting myself and knowing myself. So I talk about these qualities of myself. I like certainty. I like, school. But I also have this sense about myself that I could lose it all easily. Had this sense about myself that structure was important to me. And so I was correct in believing I was actually not so mature as a young person. And I became aware of that as I was around more people in college. And I reflected on myself relative to other people. I was just not so comfortable socially. I didn't seem to prioritize relationships, I think, like other people did. So I think I was a good observer of myself relative to other people. With that sense of lack of maturity, I had a sense of wanting to take time off from school. And the only time I remember my father giving me advice, because my parents were very hands off, believing that that would allow me to be independent. The only time I remember my father giving me advice was he said, "I do not think you should take time off from school because I think you won't return." And I listened to him, and I think that he might have been right. That I might have been, taken up with something else that I liked, and that the lack of structure for me at that time wouldn't be a good thing. The and then the protections. If I look at the do nots or have nots, I think things to protect myself were wise, and I think I had an ability to look at possible danger and try to not do those things. For me, that had to do with drugs. I felt like that would probably not be a good thing for me because I thought if I start, I might really get into it. So that was a protection. And then, as I mentioned, not taking time off from school. And for me, also being very strategic in how I made myself a good applicant for medical school. Now, I majored in French literature, actually, and took pre-medical courses, but that was also strategic. I was good in French. I loved French literature. I knew I could do well, and I thought that would be a unique part of my application. I'm sure it was. And I advised my daughter, who may be looking at medical school. She had a similar situation with her interest in ancient Greek. I thought, well, that's not that common.
So the the French literature was what we would think of now as a differentiator of value proposition or personal branding during undergrad. How to differentiate yourself from other students.
Yeah, right, exactly. So, and it was strategic. It was specifically strategic. I was, I loved it. It was great, but I thought this is a good thing. This is going to make me different from all the other bio majors, who, by the way, were doing better than I was. But I thought I was a good science student, but not a great science student. And that ability to, I think that ability to strategize was a great thing to be able to be aware of, as opposed to being naive.
The way that I think of how you described it is you had a very you were able to peek around the corner. Yeah. You were able to, I mean, I guess the biopsych terminology would be part of your dopaminergic system was fully engaged. Like you were able to see much further ahead and not be so consumed with the more hedonistic pursuits of partying on Fridays and, oh, I like this class, and so I'm going to take this class. So you were able to think much further ahead. That I think of strategy as maybe kind of a synonym for kind of future pursuit.
So I think that's a really positive spin on that decision process, and I'm glad I did it. There was a cost in peeking around the corner. The cost was for me not allowing myself to have a more broad social life. Now, I was very social, had a lot of friends, but as far as understanding myself, that came much later. That was the cost. It was not a negative. It was just, well, it was not an overall negative as I look at my life, but it was a difference that I saw between me and other people. But every person has areas of relative well-developed areas and less well-developed areas. And so I don't regret it at all. I'm just observing that was the case, and that my more broad maturity would come later.
And it sounds like you focused not on what you weren't as good at, not necessarily deficit. You focused more on, I already have some innate ability or innate interest, and so I'm going to double down on this. That's what it sounds like.
Yes. I'm going to take seriously the things that I believe I'm good at.
Right.
And not ignore areas that are relatively underdeveloped. So, for example, in college, I took a lot of courses, and I took a broad array of courses, but I did steer away from history. I took no history course because I thought that's going to be tough for me. I read slowly. I don't remember the historical facts. So I'm going to put a pause on that. And maybe later in life, I'll learn more history.
One of the other things that really stood out, and it connects with some of the language that I use and observations that I've made over the years, is it sounds like you became the average of the five people you were around most. Those roommates that were medical students,
Yeah.
it sounds like the way you're describing it is they just being around them made you a better student. It made you like kind of think about schoolwork differently.
Yes, I'm a big believer in you become, the five people around you, like
Mhm.
who you spend time with influences you greatly because, and at every age, because we pay attention so much to what's around us. And little kids pay attention to everything. From when they're toddlers, they're paying attention to everything. And as kids grow up, they're still paying attention to everything, including what their peers do. And so, and I will say parenthetically, parents try to encourage or nudge kids to get to certain friends if they believe that their friends are the sort of friends they want them to be with whatever qualities. Sure, in the people I hung out with in college did influence me in many ways, and there was that second year of college, the really good students that did influence me that way. And then I can say the other years, people I lived with influenced me in other ways, in my case, positively. It helps that I think I had reasonably good self-esteem, and I had a reasonably good ability to figure out who was a good person, who wasn't a good person. And those are characteristics that certainly make life easier if you have
Mm.
them, and make life more difficult if you don't have them so well developed.
I stuck another question into my list here, and I promise not to sandbag you here because I think it's a kind of innocuous question, maybe. Um, let's assume that when you look at your career in your life that you feel successful. Is that fair to say?
Yes.
Okay. Do you assign that success to, and we can talk about this in proportions, luck, intelligence, or hard work?
Um, there's a different response. I'd say I attribute it to my reactions to disappointment and loss and failure. Actually, when I think of, those options are all positive, and what I think of, is how I, going back to the other response, going back to how I dealt with failure or disappointment and loss. Situations where I felt like I didn't have friends or I didn't get that position I wanted to get. How I handled it, I think, shapes really how I become as a person. I think I've become what people might call a very positive person. I would view myself as I'm a not negative person. Like, I like everyone else, has had a fair amount of disappointment, loss. And I think what I've developed over time is an ability to handle those or manage those in a way that I think has made me pretty strong and pretty happy. So I think my response is how I've handled loss and disappointment, upset, has really shaped most of how I've become.
So, so that question really needs a fourth option, which is adaptability.
Mhm, mhm.
Lux, intelligence, hard work, or adaptability.
Right.
That's what it sounds like you're saying is that you've been very adaptive and course corrected along the way.
Yes, and that's been a major aspect of my parenting with both my son and daughter. And that in that, there's disappointment. Okay, how are we going to problem solve? And they joke about it. Okay, we're going to problem solve. But how are we going to solve this problem? Life is full of problems. It's not a bad thing. Problems are not bad. But how can we get ourselves up? Now, and there's a very concrete, physical situation. You bump your head. I was looking at this old video of me and my daughter. We were playing, Ring Around the Rosie, and her head goes bunk, back. She's like 1.5 or 2, and we just get up and continue doing this as opposed to her crying. And that's the metaphor of you get up after your disappointment, loss, and adapt, figure out what you're going to do, how you handle disappointment. If there's a breakup, you break up with your boyfriend or girlfriend. For my kids, break up with boyfriend or girlfriend, what comes, how are you going to handle yourself? And you don't have to immediately get yourself up, but you need to understand life isn't over. You will get through it. The way you're thinking now and the way you're feeling now is not the way that you're going to be thinking and feeling in the future. And we'll get through it together, and use your friends to help you with this.
That makes me think of Nassim Taleb's book, Anti-Fragile, where he talks about macroeconomic systems and how our vulnerability is there because we have economic systems that are resilient or fragile, but not anti-fragile. And anti-fragility is a system that actually gets more robust and stronger through adversity.
Yes.
And that, it sounds like that's what you're saying.
Yes. And, people write and talk about this, about the blessings of a skin knee sort of thing, the blessings of adversity. I say, okay, parents don't want their kids to have any adversity. Parents, we want everything to go well. That is so great. That's what we want. But we know that's not life. If we were to actually say to our kids and say the narrative is, you need to have the best life. Parents who say, I want to give my kids the best. That's fine, but make sure you understand, I'd like the best, but we know that's not going to happen. And not only is that fine when the best doesn't happen, but that's going to provide you an opportunity to grow and mature and be a better person. And so prior to your question about me giving me those options, which didn't apply, I thank you for giving me the opportunity to view that. Actually, I do think that the responses to adversity, let's say, have allowed me to be more adaptive, and it's protective. So too, later in life, when really bad things happen, it helps me to be able to have that, what some people might call resilience or adaptability, to have for me, a positive way of going forward.
Right. What do you think? I have down, like, I ask you about 3 regrets, and I don't like the word regrets, but I want to consolidate it because there are a whole other pile of questions that I want to get to. What would you say is one regret, one challenge, one disappointment that actually led to a much more positive kind of net outcome, do you think?
I think the word regret is a word that I don't think so much in my personal life, or at least I'm not thinking about it. That's very possible. We'll end this meeting, I'll go, oh my gosh, there are 5 things that come to mind. What does come to my mind about regret are clinical situations where I regret how I managed a certain clinical situation, and the same situation in different iterations comes up. It's where I was trying to manage a difficult situation myself and did not ask for help soon enough. And in each of those situations, there was, except for one where there was a very bad outcome, the thank goodness the asking for help saved the day. But the regret was that I didn't ask for help sooner, and that I didn't understand I need to step back and say, what can I do about this? So, and I think that's a common thing with young people, that they don't understand that they can ask for help, whether it's tutoring for a class in school or get some help to just talk through an interpersonal situation. I think that young people don't understand that they are oftentimes around people who can help them. And sometimes they're in a situation where they don't understand who it might be who could help them, but they may be able to figure that out.
That might be a good segue to jumping over into kind of talking about young adults, college students. So in your practice and now also your work with graduate students, medical students, as well as if you're comfortable like talking about being a father of young adults, what have you noticed? What trends have you noticed in terms of young adults over the 5, 10, 20 years? Like what have you seen changing, whether it's coping skills or the amount that parents are jumping in and snow plowing? What trends have you noticed?
Well, I think that there's a clear, dramatic, exponential increase in young people's experience of stress and isolation.
Mhm.
So, the reason I mentioned exponential is, to me at least, the amount of energy that I expend thinking about this seems to be exponential. And maybe that's me only, or it just seems like there is this dramatically increasing awareness about stress and talking about stress too. So that's fair to say. Well, people may be more communicative about their stress, but also isolation and the negative effects of isolation. I view as um, big changes in the past 5, 10 years. With parents, I think that parents have a dilemma, and parents come from their own backgrounds, and if children have the good luck of having more than one parent, they get different perspectives often. But parents often are either over involved or under involved. So the overall involved parents might be called helicopter parents or whatever, but what they're trying to do is keep their child from feeling distress or upset and maybe eventually disappointment. They don't want their child feeling uncomfortable feelings. And so what they do is try to manage things so that things have what they view as positive outcome. And so those would be the parents who are over involved rather than allowing their children to sort of organically figure out how to take more and more autonomy for their decisions, whether it be how much they study for school or not, whether they stay up late or go to bed early because there's a test the next day. Those parents who are over involved and trying to manage it, that works for some kids who welcome it. But that is something that I see increasingly, and maybe fairly over the past 20 years. But also the opposite is true too. There are many parents who are under involved, and they're believing that a more, what I might say, permissive and structureless situation really allows the child to develop mostly. And that may apply well to some kids. So not all kids have the same temperament and executive functioning skills, that is the ability to get stuff done skills. But parents who are under involved sometimes really ought to be more involved, asking more questions about the decisions the child's making, maybe insisting on certain things. So one example comes to mind for the young adult or adolescent who wants to go to art school because he likes art, but isn't very productive in art, just likes art. That parent might want to ask more questions and maybe perhaps not fund art school. That would be an example of a parent maybe needing to be more involved. But as I view young adulthood and the primary problem, the way I conceptualize it, and this might not be popular, but I would say it's about a change in the narrative and young people being misled by the narrative. The narrative is what happens in life and how should you be. So one example is the narrative as a young child is have these characteristics. Be nice to people, work hard, take care of people, don't talk negative about people, finish what you start, don't be a jerk. And then what they've been told does not match as they get older what they see. What they see is, oh my gosh, people are not always nice. People do mislead other people. Some people say negative things, and they see this in leaders. And that not to be, my point is not to become political. My point is to be psychosocially aware of what happens to kids who have a narrative that they've been told, and then they see, wait a minute, I've been misled. That causes confusion and stress and also anger. If we go to another possibility of the narrative is everyone's a winner, everyone gets an award. And follow your passion, because your passion will lead you to success. ... Hey, not everyone's a winner. Hey, that wasn't fair. They got chosen, but I didn't. That wasn't supposed to happen. And my passion was art school, and I can't go to art school. Wait a minute, that's not fair. I'm confused. I'm upset. I'm angry. I would say too, then, less than 10 years ago, this alternative facts idea came up. There are alternative facts. But the narrative is facts are facts, and we have science. But wait a minute, facts are not facts? That's really, really confusing. And it's just confusing. And it puts me in a very tough position trying to make my way in the world when I'm trying to figure out what's real. And then you have the proliferation of negative or manipulated information, including AI, makes that much more complicated. I think another aspect of a narrative is we're free to have different opinions. Everyone gets along. And then this is much more recent. There's a right and a wrong. And you better believe me, because then you're out. But wait a minute, we call it polarized responses. But the narrative was not polarized. The narrative was, we can have different opinions and all get along in our community. So I think that the narrative changes have been a huge problem. And so if you get into the mind of a young adult who's struggling in some way, you probably can ferret out some of that distress about, we've been duped. This is not right. And we're very uncomfortable because we were told the world would be a safe place that we could predict in some way. But now it feels like the world is not safe and we're not able to predict it.
And also, so much of where their information or infotainment is coming from, that narrative that's being reinforced, is from just a few companies that have figured out how to make their product very sticky and very addictive, in the form of Meta or Facebook and Instagram and Snapchat and TikTok, and providing information to college students, young adults, that's not neutral. It's actually curated. It's a curated algorithm that's putting in front of them a specific message of some sort.
Well, we think negatively about that because we don't want something external to us curating what we see. However, like I did say before, that we want to perhaps do work in areas that we're good at. So the curated information is stuff that we're interested in. So we get sent stuff that we're interested in, that we see, but it's just a morphed up demonstration of we pay attention to stuff we're interested in.
Have you noticed a difference from medical students? Like, do you see a qualitative difference in the way medical students, let's go back to how we were talking about luck, intelligence, hard work, and adaptability. Have you seen a difference with medical students that you worked with over the years, where there's more entitlement, or they have a feeling that they conflate with being a fact, and or maybe almost like a sense of over-empowerment, that faculty now need to be careful around students, because everyone got a medal. And if you don't give every medical student a medal, I don't know, I'm not in that world, but I wonder like what you've seen, if you've seen changes with students.
The students look at facts and they want information. What is we were having a discussion with about a week ago with a large group of other faculty at Penn was how students select what information to use. So for example, in a course that I teach, there's a course called Doctoring, and it's a beautiful course on basically the humanistic and professionalism aspects about medicine. It's a very structured, beautiful course. And I was talking to my students that the course directors really are very responsible in looking at the type of work that they require and the requirements. So anyhow, there was one required reading, which is a beautiful essay that took like 10 minutes to read if you're a quick reader. I asked the students who read it. No one read it. And I said to them, just to let you know that you're not being overwhelmed by reading. For me, when I read this elucidated a lot of things that was really great. It came to be in the larger faculty meeting that the students all have a required plenary session where this topic was about working with older adults. And the plenary session was a beautiful session with a multidisciplinary treatment team talking about their experiences, and lots of good things came up in that meeting. So about a quarter of the class showed up. And the question was, should we require this? And the medical school had gotten a lot of pushback from the students about too many things being required. And so that's a dilemma, because these are young adults, they're very capable people, they don't want to be overwhelmed, and they can invoke well, this is our wellness initiative to not be overwhelmed with work, which is a very strong, good thing to be concerned about, but they're also missing out. And the question is, how much should we be forcing the students to be doing certain things? We're figuring this out, because I think the bottom line is we don't want to be in a position of forcing, because one's ability to learn is really based on their openness, sort of like therapy. If you're going to therapy because you don't want to be there and someone's making you and you're not open, then nothing's going to happen. But if you yourself want to be in therapy because you want to understand things more, then you're going to get more out of it. That's my long answer to changes in medical education and the entitlement about deciding what you're going to do. I mean, I think students know that there are certain roles and rules in the medical treatment setting. If they're medical students, they cannot call themselves doctors. They cannot do certain procedures. They must have things signed off by trainees, et cetera. And that's the rule. And then they're out if they don't do that.
Let's shift from students, young adults, college students, grad students, to the parenting side, because I know that you spend time with parents as well sometimes. What do you wish parents understood that seems really difficult to convince them of?
I didn't realize I really like this word certainty and uncertainty so much. But I'm certain that I think it's important. I'm certain that it is important. I think helping parents understand that uncertainty is a part of life, and that you want to do your best to communicate with your children, understand them as best you can, and also have them understand you. Have that relationship be as strong as possible. And then you'll figure things out. And it may be convenient, or maybe in a convenient way or an inconvenient way. I want parents to understand that there's not always certainty about what will happen if they do something, but also understand about the usage of the words convenient and inconvenient. So if you have a child who's, let's say, saying, okay, I'm going to study in school, do well, and go to college, like many parents want, that's convenient. Or let's say they do well in college. Boy, is that convenient. But many times things are inconvenient. And that's, different. I pause to say it's less desirable, because it's not less desirable, because the things that happen that you wish didn't happen are often blessings in disguise, or really reflective that we don't know what's going to be best for people. What we want is to be able to live life and adapt, as you say. in a way. And so I think that's a powerful message, the ability to embrace uncertainty, to be comfortable if you don't know the answer, and not to feel as a parent that you need to know the answer. I think these days of parents giving advice that then leads to a certain outcome, those days are gone because the world's changing also at an exponential rate. And so most parents are not able to predict. And that's also leading to kids' anxiety too, or young adults' anxiety, that they are not able to predict so well. So the idea of giving advice is not always possible. But what parents should be doing is engaging with their children at whatever age and trying to communicate and listen and giving ideally the thought, we'll get through this. Now, having that attitude is a luxury if you're financially okay. If you're not financially okay, including if you're parents who don't have the ability to help out a child if things don't go well, that's a very different matter.
It makes me think that it's not just parents want to clearly define a kind of a linear path for their kids, and reduce chaos, but also increase predictability. It also seems like a way that they're mitigating their own anxiety. Parents are it's almost like shooting on their kids as a way of lowering their own anxiety sometimes.
Yes.
And it seems like, and I'm using a lot of these pejorative words, but almost enmeshment. That's what it sounds a little bit like. What you're saying is it's not just parents removing friction from the system to help their kids. It's also parents removing friction from the system to help their kids to deal with their own stuff.
Yes. And so we've got terms like enmeshment and all. And I would say for me, I became aware a long time ago that I really did not want my kids to experience failure. I didn't want them to be disappointed and sad. And then someone used the word codependent. And I thought, I am not codependent. Oh, yes. So codependent means that my emotional state is dependent on their emotional state. I'm so codependent, or I'm trying not to be. And we could say, well, I'm enmeshed because I'm enmeshed in wanting to make myself not feel anxious. So I'm going to try to insist that things go a certain way with my child. People said a long time ago, your biggest way of learning is from your children, and completely. So, my son, especially who's 27, teaches me a ton about evolving my way of being. And it's funny because I think of myself as a pretty evolved, thoughtful person, and sure, but I'm far from a solid A if we're going to grade myself. But even that's ridiculous, grading myself for that. Let's just be. But I think owning my own big imperfections, including my wish to keep my kids from discomfort. My son will say that. He said, that's your issue. Oh, yeah. And he does not seem ostensibly to be as concerned about the lack of certainty as I do. And I think he's in it. And he's an intuitive person. I think he senses stuff that it's just different than what I experience. And if he were to say it, he might say, chill, it's going to be okay. And my response, if I'm honest, would be, oh, I don't know if it's going to be okay.
Right. I mean, that makes me think of stoicism and cognitive behavioral work, separating thoughts, feelings, and choices. I think so often parents have their thoughts, feelings, and choices all mushed together. And so they're reaching out to the faculty member to make sure that there's extra time for a test for their son or daughter.
Yes.
Whereas years ago, students did all that stuff. Students needed to contact their professors and advisors. And parents have this emotional response, and it is directly connected to this impulsivity or maybe even compulsion in terms of like their behavioral response. And it sounds like you're observing that like you still have the anxiety from a parenting perspective, but you've separated the behavioral response. That
Yes.
there's not that impulsivity. And your son, in the most gracious, loving way, points out, "I've got this, Dad." Um,
Yeah. Yeah. It's the parents who might step in and try to help. In part, they're doing that because I would say young people have less opportunity to learn socially how to interact with people, including to ask for help. So, it's amazing we've gone so far in this talk without talking about the P word, phone. But people who are spending so much time on the phone, not looking up, not engaging with people, are not going to do the social learning that's critical when you're a preteen and teen. And so the parent who's then speaking with the teacher to get extended time for tests might be doing it because the child is saying, "Oh, I'm not going to talk to the teacher." Now the parent should be saying, "Let's figure out how you can talk to the teacher," but the parent may step in. The difficulty people have engaging socially, including asking for help, is directly in response to having fewer social interactions. And I do think COVID for people, especially when they were 11 to 13, that really put the halt on social learning that way. And it's increasingly difficult for people to know how to ask for things, how to be with people. And that then leads to this, the isolation aspect that I mentioned a while ago.
uh, we've got a little bit of time left. I want to talk about providers for a little bit. Let's jump
Yeah.
away from clients and families and parents. And
Mm.
what do you wish the mental health providers understood or did differently in how they work with young adults, college students? Like, what do you see going on with all of the mental health professionals that you interact with, where you walk away and you say, "Man, I wish they were doing it a little differently. I wish they were addressing this or accessing this kind of body of knowledge and research." Like, what do you think they could be doing differently?
Yes. The first thing that comes to my mind is I'm amazed at how so many providers are doing things so well, that there are so many good therapists that when I hear about your work that young people are doing with therapists, I am so grateful that the therapists are there because they're doing really good work. I'd say in general, that's the impression I get. And I'm a critical person. I may seem nice, but I'm very critical. I have high standards. I think in general, people want answers. They want to be told what to do, and sort of like in the binary way. That people want to know what's right and what's wrong. And I love the example of working with, let's say, a transgender person as just as an example, because that's concretely maybe a binary situation or a non-binary situation, about gender, and people want to know. So let's say young person wants the provider to help them with their choice in whatever binary option that they're describing, and they want certainty and they want a plan. And the parents are like, "What do we do?" The advice to therapists, to providers in that situation is like other advice I would say is, let's try to be comfortable with the uncertainty. Unless with transgender, for some people it's super clear and that's fine, but for so many people it's not super clear. So let's try to be comfortable with not being sure what's going on. Let's try to understand. But I need to understand because I need to take action because I'm not my authentic self. And only until I take action and become my authentic self will I be happy. But therapists, I think I would advise therapists to try to be increasingly comfortable with uncertainty and trying to work on things, and yet having the belief that by taking oneself seriously, you'll have an answer which makes sense to you. So
It's
my advice to providers is to try to be patient with themselves too, and they may have this uneasiness about not having the answer.
Almost like
And
there's a pressure to serve the client really well, and serve the client in an expeditious way. We don't want to be perceived as just kind of running the clock out and just waiting for the next session. And you're saying like it's okay to slow down and operate in the gray.
yes. Now, if the therapist is trying to respond to a managed care company for insurance and try to, say, we're giving you 8 sessions, and you better document what your response is. There are ways that providers can learn to respond in a way that tries to comply with the request for information, and is pretty true. But there can be external stressors like that try to pressure the therapist, the provider, to be very concrete and demonstrate that there's movement. But many things take a long time, actually.
Let's keep expanding out. Let's go to a macro level. You and I are both under this big umbrella of mental health, behavioral health, and healthcare. If you could rebuild mental health as a system, interventions, diagnosing, analysis, the therapist's hour, if you could rebuild the system,
Uh-huh.
how would you rebuild it? What would you do differently? What would you do the same? And I know that that's a massive question, but I think so often about and I use the example of like the therapist hour. It's still a mystery to me, other than Freud's townhouse, 100 plus years ago. Where does the therapist hour come from, and why do we still use it? It seems like a dinosaur. It seems antiquated. Is it really the most effective way to use our time? And so, I mean, you are in this at not just a clinician's level, but also as a faculty member, kind of bringing up the next generation of professionals. What needs to be different? How would you rebuild this system?
Well, I could begin concretely and talk about the therapist hour, what we do, but I think that when I think of what could we do different mental health wise, I'm thinking of more social systems.
Hmm.
So the therapist hour, the idea of once a week therapy, that's totally artificial. That no one ever said that once a week therapy is the way to make change. Frequency of meeting and manner of meeting really would come from what makes sense. So the idea of even like taking a walk, doing wilderness programming, um, experiential work that may make sense. That may actually be therapeutic in a certain way. Sitting and talking in a comfortable office might suit certain situations, but maybe not. I think having the therapist in schools makes great sense, and that would be one thing I would say for changing mental health. I would have it accessible within the school. Now, the idea of privacy is an issue, but that can all be handled. I think when we talk about what can be different therapy-wise, I think of why are we in therapy? Why are patients or clients in therapy? And let's say increasingly they're in therapy because of, let's say, young adults dealing with stress and isolation. And so I think the ways to approach it are actually largely psychosocial or social. So I think there should be, I know that's controversial, but I think there should be mandatory service after high school for 2 to 3 years, where there's a department of mandatory service or whatever in the government, and people live and work together. And they're people different than us. They have work, and you get exposed to people who are different from you. The challenge in that are going to be all the people saying, well, I need special accommodations because I have a disability. Okay, but that can be dealt with. Okay, so that's one idea of mandatory service. And I think what that does is it addresses isolation, certainly, and it addresses our ability to communicate with each other and also deal with the narrative. Like when I mentioned before, the narrative of what we're told and what we see, that what we see may be more more controlled and maybe better if we have that opportunity. I also think that in a social way, I think that we should be making multi-generational community centers where people have the ability to go to community centers of people with all ages, and you get support, you're not isolated, you talk with each other. So these are ways to address the features that people are bringing to therapy itself. It's not addressing your concrete question of what do we do in the hour, but I'd step back and say, these are things that will make a difference, I think, in our need to have a therapist hour.
I love that idea of mandatory service. There are a few countries that have mandatory service, whether it's military or civic service. And it strikes me that it's a way to force people to have skin in the game. It's a way to force people to maybe expand or develop some empathy. Also, going back to earlier part of our conversation, it also forces them to develop some adaptability too. Um, how does medication play into kind of a new paradigm? Or let's say let me expand that, not just medication, but maybe a biopsychosocial view of client work. Because that's something that I've been surprised with my entire career, that therapists, counselors, marriage and family therapists, social workers, we have Teflon brain when it comes to what's happening physiologically, neurologically. It seems like we primarily focus on just emotion, and maybe some thoughts, maybe a little bit of behavior. How does what needs to change in terms of the new paradigm in terms of medication and a biopsychosocial or a biopsychological model?
Yeah, I'm reminded of this very funny video that, speaking of phone and sometimes spending too much time on the phone, it was a very funny video where this young lady was being interviewed, and she says, "I'm depressed. I have no idea why." Somebody says, "Are you sleeping well? No. Are you getting outside? No. Are you eating well? No. Are you seeing friends? No. Are you working? No. But I have no idea why I'm depressed." The thing is, there are some basic things that people are not thinking about as really critical to healthy living. And so I do get to this social aspect, and I'm talking about these interventions socially for us to be with other people. But I think that putting yourself in a situation where you can be with other people is a primary treatment effect. And I think about suicide a lot, because I think suicide is often the response people have to not believing that anything will be better. And people are feeling simply alone, disappointed. So I think this focusing on the social aspect is something that I think about a lot. And people come to me often they want medication. And so medication can be really good to help people function better based on the severity of their emotions. So certain disorders do very well with certain types of medication, like bipolar disorder really requires medication for people to feel better, whether it's a mood stabilizer or antidepressant. That really helps. But increasingly, people want medication for stress, and they want to dampen the degree of stress that they have. And some medications can do that. I sometimes call it cosmetic psychopharmacology. People want to dampen the degree of discomfort. Sometimes I'll prescribe for that reason, but sometimes I won't. But there are things that make a big difference in how we feel. Our nutrition makes a big difference. So if we're eating just lots of carbs, we're going to be tired and sluggish. Probably a lot of processed food is going to make us feel irritable. Whole foods, close to the ground, grown foods will make us feel better with a higher glycemic index with that. So nutrition will make a big difference probably. Hydration actually will make a big difference if you're hydrated well. Exercise makes a huge difference, and people are intimidated to get exercise. But what I mean by exercise is simply activity. Move your body. And that can be walking, it can be pacing in the room, and that's it. But people often just feel overwhelmed at the idea of exercise. Like it has to be these guys on YouTube who are like buff. And if you're not buff in that binary way, they're not enthusiastic about doing anything else. But being active is really critical to one's mental health. And then trying to be social. And the phone gets in the way of that, because increasingly people are socialized that when they're out in the world, they should be looking at the phone. If they're not, they're going to be viewed as a loser. But if they're not looking at the phone, then it may look like, well, no one wants to talk with them. But if they're not looking at the phone, that's when you can make eye contact. And that's when things can happen. Social connection can happen if you believe that it can happen. If you've lost hope, then that's different. There are increasing number of body interventions that will help people when they're feeling really, really depressed. So we have transcranial magnetic stimulation, which is you put it on your head and you get treatments, and it helps greatly. People are increasingly interested in the psychedelic and near psychedelic substances like ketamine, psilocybin, as well as a way to get out of their negative experience. And also certainly people use marijuana a lot to dampen their emotions and to do all sorts of things. Marijuana is a toughie in that marijuana causes all sorts of difficulties like anxiety and paranoid thinking. And people don't like to think about that when they've become reliant on marijuana.
Yeah, no, it also seems like today's marijuana is so different than
Yes.
10, 20 years ago because of the legalization, which led to the industrialization, which led to the use of herbicides, pesticides, and also greater THC concentrations. And
Yes.
that seems to have definitely changed. It changed my opinion quite a bit on weed. In the beginning of my career, what the research I read was, yeah, weed might actually be helpful for getting to sleep and, kind of like you said, dampening some of these like stress responses. Now it just seems like it is absolutely tied to an escalation in anxiety with very little dose or frequency.
Well, I think that it is tied with dose and frequency. So the products are regulated now when you get them at a dispensary. So there goes the argument that, oh dear, these substances are not regulated, but they are regulated as far as, there are pharmacists, marijuana pharmacists, but the dosage is really high in so much of them. So the higher dosage do cause more difficulties. But there are people who have a family history of psychosis or bipolar disorder will be the ones who have most difficulty, most clearly using marijuana at any dose. So if I know that someone's considering using marijuana, I'll want to review their family history, and I may tell people, do not touch it. And there have been many people who've been very hurt by marijuana. It's ruined their life because of exactly that they've taken it, become psychotic, gotten in trouble, and it's a problem. And they will not touch it now. They know. Yeah. But the appeal of taking a substance to change the way you're experiencing the world, it's always been appealing. It's just that it's difficult. And the young people who like preteens or young teenagers, people between 11 and 16 using marijuana, that is the time to absolutely not be using it if possible. If you're going to use it, use it 16 and above, it'll affect your brain less in theory.
Because of the way the brain is forming during that adolescent period.
That critical period of development. Yeah. So exposure to substances, particularly marijuana, during that critical period is the worst time to be exposed. If you're going to use it later in life, it's different. Not to say it'll be safe, but it's less likely to cause long-standing trouble.
Right. Steve, I know that we need to wrap up in a few minutes. I appreciate all your time today. If someone wants to learn more about what you do, if someone wants to contact you or try to become a patient of yours, what's the best way for people to contact you?
Well, I increasingly do speaking and mentoring, but I have a practice where I have a couple other people who work with me, and it's called Haverford Psychiatry outside Philadelphia, and that's great fun because I get to work with two colleagues and an administrator who's a nurse, and we talk a lot, and it's really fun to talk about people and cases, and this sort of work is fun, sort of like you and I have fun talking about our case and our situation. And yes, that's how people can get in touch with me.
Excellent. Well, I will make sure to put that in the show notes so that people can um, follow that link and learn more about you then. So, all right, Steve. Thanks so much for your time this morning.
My pleasure, Rob. Good to see you.